How does CF newborn screening work for babies? Imagine a tiny blood drop from a newborn that could help catch cystic fibrosis early. That's exactly what happens in newborn screening for cystic fibrosis. This test is usually done within the first few days after birth to find out if a baby might have CF before any symptoms show up. Early detection means doctors can start treatment sooner, which can help the baby grow better and stay healthier longer. The process starts with a small prick on the baby's heel to collect a few drops of blood. The blood is then placed on a special filter paper card and sent to a lab for testing. The first thing the lab checks is the level of a protein called immunoreactive trypsinogen, or IRT. This protein is made by the pancreas and in babies with cystic fibrosis. The levels are often higher than normal because the disease affects pancreatic function. If the IRT level is high, the lab does a second test on the same blood sample. This test looks for common mutations in the CFTR gene, which is responsible for cystic fibrosis. Babies with both high IRT levels and at least one mutation in the CFTR gene are considered at risk and are called screen positive. But remember, a positive screen does not mean the baby definitely has CF. It just means further testing is needed. The next step is a sweat chloride test, which is the most reliable way to confirm cystic fibrosis. This test measures how much salt is in the sweat. Babies with CF usually have higher salt levels in their sweat. This test is done at specialized clinics that have experience with CF diagnosis. It's important to know that some babies who test positive on the screening may just be carriers of the CF gene or may have false positive results. That's why follow-up testing and careful medical evaluation are essential to make an accurate diagnosis. In summary, newborn screening for cystic fibrosis involves collecting a small blood sample soon after birth, measuring IRT levels, testing for CFTR gene mutations if needed, and then confirming with a sweat chloride test if the initial results suggest CF. This multi-step process helps identify babies early so they can get the care they need to lead healthier lives. All babies should have this screening as part of standard newborn care, regardless of their family history or background. If you have concerns or questions, always talk to a healthcare professional for personalized advice.